The type and screen only test the recipient's blood. The type and screen is frequently done preoperatively for procedure. If there are antibodies present, the blood bank will identify a selection of potentially compatible units. As stated on a previous slide, type A blood has A antigens and is considered to be Rh positive. People with Rh negative blood have D antibodies. Displayed is a chart showing the compatible blood types. Recipients can only receive blood that does not contain antigens which they have antibodies to. Blood product contains what? Packed red blood cells contain only red blood cells. Platelets contain only platelets. Platelets contain age should be avoided. FFP comes from the separation of whole blood by centrifuge. FFP contains all plasma proteins and most clotting factors. Factors 5 and factor 8 decline during storage. FFP must be ABO and Rh compatible. Cryoprecipitate is what remains when fresh frozen 4 degrees Celsius. It contains concentrated levels of factor 8, factor 13, von Willebrand's factor, and fibrinogen. ABO compatibility is not necessary for cryoprecipitate. Packed red blood cells are collected from whole blood. Whole blood is collected in bags containing a citrate preservative in order to cleat the calcium present in the blood. The blood is then centrifuged in order to separate the blood into its different components. CDPA preserved blood has a hemoglobin of thawing. Platelets are one component that is separate from whole blood during centrifuge. Apheresis platelets come from a single donor and have a volume of 200 to 400 milliliters. Apheresis platelets contain the same amount of platelets that would normally be collected from 6 to 8 thawed FFP that is maintained at 6 degrees Celsius for a maximum of 5 days. While it is immediately available, it has a decreased level of factor 5 and factor 8. Because of this fact, it is not advisable to give thawed platelet plasma to those with factor deficiencies, DIC, or neonates. Cryoprecipitate is the precipitate that remains when FFP is thawed fully at 4 degrees Celsius. It contains concentrated levels of factor 8, 13, von Willebrand factor, and fibrinogen. Most bags contain 5 to 7 units. Cryoprecipitate is stored at negative 20 degrees Celsius and must be thawed immediately prior to use. This is the list of my references. Thank you for listening to my presentation.